Now, after today's presentation, we have some light refreshments, and then we move into our support group meeting, which is held out the back here. So everyone's more than welcome to stay for the support group meeting. For those who don't know Graham's a retired doctor and retired physician, and he's accumulated over 50 years of medical practice in numerous countries, including being a consultant physician at Nambour Hospital, which could be classified as a country, but we won't go there. His travels has really exposed him to a myriad of different diseases and various lifestyles and traditions across the Pacific and Indian Oceans, the Middle East, Maori and Aboriginal cultures as well. So Graham has a whole host of qualifications and experience. He's also given numerous presentations to U3A, the University of the Third Age, and countless papers that he's written, journals, magazines, presentations. So I'd like to welcome Graham again. He's got his high-tech pointer with him this time, and we'll certainly be aware, don't muck around.
Yes.
Over to you, Graham.
Thank you. Thanks, Chris. So pay attention or you'll get a severe talking to. This is low technology because the pointer doesn't actually, for some reason, work on this screen. I don't know why, it's beyond me. Anyway, here we go. So this is me. This is one of the talks I gave to U3A, as Chris mentioned. This was a series of talks over a couple of terms. I've done that twice now. So I've had a little bit of a refresh in terms of alternative medicine and its role in various parts of medical treatment. But today, as Chris said, the first talk was about just how the modern orthodox medicine developed from alternative medicine over time, and how there's still quite a lot of overlap between the two. But just starting as we are today on cancer, this is the sort of starting point. What is cancer? How you diagnose it? And then you get on to the more interesting things, perhaps, of what the alternative treatments are. So cancer is uncontrolled cell division. And now, at any time in any human body, there are things, the cells that are dividing, and sometimes that division can go wrong and can produce abnormal cells, potentially cancer cells. But as we're young enough and our immune systems are fit enough, then they can comfortably deal with these abnormal cells, mop them up before they get out of control. So if they do get out of control, then you've got a cancer of some sort, and it can spread either by the lymphatics or the bloodstream, typically to these parts of the body that you probably read about: the lungs, the liver, the brain, the bone. They're fairly common sites of spread of a cancer if it gets away. And this is nothing new. Cancer's been known about since forever, although the actual cause of it was not known. You can see it's been found in specimens millions of years old. It's not a new modern disease condition. It's been around forever. What has changed is the treatment approach to it. And apart from the early days when there were really no specific treatments that were effective, it was only in orthodox medicine when we got into adequate anesthesia, putting people to sleep so you could chop bits off, that you started making some progress. And then in the early 20th century, radiotherapy first became discovered as an option in terms of treatment, chemotherapy, and now we're into all sorts of different stuff. Now, I have to point this out because ladies are always complaining they're discriminated against. And here is the reality. You can see Australian statistics, both in terms of cases diagnosed and the death rate, that us poor males are sadly disadvantaged. But does the Discrimination Commissioner do anything about this? No. Apart from there's a slight sex variation, the other important factor in cancer development is getting older. And obviously we can do nothing about that. But you will... Can we? Oh, right. You've got the elixir of life, have you? So if you can see these statistics here, Cancer in the young people is very uncommon, increasing in frequency the older you get. And so in practical terms, old, which used to be considered over 55, I guess that's now middle age, the majority of the cancers by far are in that age group. And there are some explanations for that we'll go into a little bit. Part of the historical story with cancer has been exposure to chemicals which potentially lead on to cancer. So I've got a few old favorites here: asbestos, obviously, arsenic, as a whole range of different chemicals have been shown to cause cancer. So this was probably the first occupational cancer diagnosed. These are not, in fact, African children. They are children who were stuffed up the chimneys to clean the chimneys in Victorian England, and inevitably got covered in soot and carcinogens from the burning coal. And one of the common, not common, but one of the recognized cancers, they got cancer of the nether regions, because obviously not hygiene, and this stuff stayed there forever. Asbestos we think of as a cancer-causing substance of the past, but there's still plenty of asbestos around. When you look at any old building, you'll see that special precautions have to be taken in terms of dealing with either insulation or carpet underlay, those sort of areas where asbestos can still lurk. And asbestos leads on primarily to lung problems with lung cancer and mesothelioma, and it can be years and years after you've finished your occupational exposure. Just showing a couple of X-rays here. You can see this is an X-ray of the lungs, obviously the heart here. You can see down this side there are some whitish patches, and again there. And if you look at a more complicated CT scan, you can see something going on at the edge of the lung, which is more typical appearance of the plaques of asbestos. And this is into the modern thing. You probably read about the ridiculous cost of renovating the Reserve Bank building. They're looking at $1.1 billion to clean this building up and turn it into worthwhile accommodation. So even in Australia, we've still got plenty of problems. And obviously in other areas where working circumstances are much less safe, breaking up ships in India, for example, asbestos everywhere as insulation. So major problems of that sort. And then we're getting to the modern time now, as our society moves on from the old cancer-causing drugs, we get into new areas, and microplastics. So everybody's read about nowadays. These get into not only into the water, but into the food chain and into your body. And there's evidence that they're promoting different types of cancers. So we deal with one problem and another problem comes along. Here's another one. Forever chemicals, you've probably heard about them, primarily used as fire retardants, but in non-stick surfaces as well. And these are now everywhere in the environment again. And in Australia, they're particularly found in defence sites, because they've used fire training activities in these sites. So water supply has been contaminated in various areas. So big problems. And I said we've got three types of PFAS cancelled, banned in Australia, but there are thousands of them. So who knows what's going on worldwide. Radiation is one of those big concerns in Australia. I think totally misguided, but it is, we all get radiated all the time. If you walk out into the sun, you'll get radiation. If you take an X-ray, you get radiation. If you go in an aeroplane, you get more radiation because you're at altitude and the X-rays get through more so. So everybody, or historically, has been concerned about nuclear power in this country. Nuclear-powered submarines have been running for 60 years without any problem, but apparently nuclear power is a problem. But only two nuclear power stations have had problems. One was a test which went wrong, and the other one was a tsunami. And their consequences, even at the worst case scenario, have been minimal. So meltdowns aren't necessarily the end of the world. Ian may want to say something different. Here's another example of radiation naturally occurring. This is one of my travels. This is the Seychelles. This is the house. This is my lovely wife lived in. And you can see this large thing here. This is a lump of granite. And the Seychelles are unusual islands in that they're not volcanic and they're not coral, which most islands are. So this was a little bit of original rock that was left behind when Africa went that way and India went that way. So this is traditional granite rock. The island looks very pretty, but sometimes these lumps are so big that you actually have your house built around them. And certainly one wall of our house had a lump of granite like that. And granite emits radon gas. It emits radioactive gas. And so if, for example, if you lived in the south of England where there's a lot of granite, in your cellar, you'd have extractor fans to make sure that the radon gas didn't accumulate. Nothing like the same level as having a nuclear bomb go off, obviously, but still cancer-causing potential. And this is more what put Australia off it. Obviously, these are the Maralinga tests in the, I think, in the 60s, and there's still concern about clearing up the area thereafter. But the long-term consequences are difficult to evaluate. This is part of my time exposure to nuclear stuff. This is a Vulcan jet bomber. It's an enormous thing when you stand next to it. The actual air crew are all in this area here. You've got 5 crew in there, 2 pilots and 3 rear crew. And they carried, in those days, they carried nuclear bombs. And so I was on a flying station. It had 3 squadrons of these planes, and not that they were going to go bang, but if they fell off the back of a truck and got bent a bit and leaked, then you had to have somebody on site who knew what it was all about. So I was a radiation safety officer at that time.
Sorry, can I just ask you, were you in Maralinga at the time they were?
No, it's not quite that vintage. So could have been, but Fukushima, I see, sorry. Fukushima, one of the 2 sites we talked about briefly, an enormous number of people, as you can see, died from the flooding itself and the damage that was done. You can see an enormous ship in the middle of the main street. The damage was significant, but the actual deaths from radiation were hardly discernible. So that just shows you how the concern about nuclear power stations can be overrated. Anyway, enough about that. So how are we getting on with cancer management nowadays? Well, you can see these are fairly competent looking lines. So going back to the 80s, so over the last 40 odd years, the annual mortality rates from cancer have declined quite well, and suggesting that treatment methods are improving. And this is against the background that people get more and more elderly people exist. So you'd expect that the incidence should go the other way, if anything. And similarly, cancer survival rates. Fortunately, this is non-discriminatory, as you can see here. So that's all right. So what do we do to, in the modern world, what do we do to look for cancer? Well, increasingly nowadays, we're doing screening tests of various sorts. And I've just listed a few things here. Examination of the spit looking for cancer cells, particularly in smokers. I used to do a lot of endoscopy stuff and checking stomachs for ulcers and so on, and similarly with looking at the bowel for bowel cancers. That's increasingly become mainstream. For ladies, mammography, cervical smears. For men, regular prostate examinations. And as Ian and I were talking, skin cancer obviously is one of those favourites of this country as well. And that should require regular examination. Now, the other point, apart from avoiding getting older, is that you've got to pick the right parents, because obviously genetics are an important part of the cause of cancer as well. And there are a zillion things written down here. There are a whole range of different blood tests that can be done for those who have a family connection to see if there is an increased risk for you, and perhaps it might even lead on to a mastectomy or something like that if you have the wrong genes. So pick the right parents, obviously quite difficult to do, but that's a good thing. I mentioned skin cancer. You can see Australia, top of the pile. It used to actually be New Zealand, I think, so they're not keeping their game up sufficiently. And this is per 100,000. So you can see Australia is a significant leader in skin cancers throughout the world.
I want to ask you a question. Why is Germany up there?
Germany, well, it's fairly low down the pecking order. Yeah. So I'm sorry. Yes. The number. Well, it's much bigger population, obviously. I think a lot of sun exposure as well, even with the climate being relatively inappropriate. Anyway, yeah. Hopefully none of you have come across these sort of problems. Melanoma, fairly typical appearance, black-looking abnormality. I'll talk a little bit more about the management of these cancers. BCC, basal cell carcinoma, SCC is squamous cell carcinoma, and this one we've just about seen the end of now. This is what's called Kaposi's sarcoma, and that was part of the AIDS infection, and that has fortunately not got away on us. So for melanoma treatment, the treatment is improving enormously because of adjuvant therapy, immunotherapy to get the body's immune system improved, even designer therapy for the individual patients using your own blood cells and re-engineering them and then putting them back into the body to attack your own cells. And we've got vaccines for melanoma coming along as well. So things are changing rapidly with melanoma. Stomach cancer, that's just a stomach inside with a nasty looking lump in there. And we've had these sort of known causation factors for many, many years, with a higher incidence in Japan, despite their diet. It's what they do with their food that increases the risk. And this is one of Australia's claims to fame. In fact, the guys in Western Australia were the first to find that the underlying chronic cause was an infection in the stomach with a bug called Helicobacter pylori. And with eradication of that, then the instance of, and you can do a blood test to make that diagnosis, eradicate the infection, and the incidence of cancer falls. Bowel cancer, again, if you pick the wrong family and they have a condition called familial polyposis, you get these little lumpy things appear, and if they get big enough, they can turn into cancers. And this is an X-ray of the bowel from below. You can see this transverse colon should continue across there, the same as this side, and there's obviously something nasty in there that's not doing good. Prostate cancer, increasingly common in developed countries because people are living longer again, and there's not been a great deal of change in treatment, but there's been a great deal of change in diagnosis, and more mild cases of prostate cancer are being discovered, and it's now being appreciated that a lot of these actually don't need treatments. Sometimes the treatment cure can be worse than the condition, and sometimes if it's a different sort of prostate cancer, you can die with it rather than from it. So things are changing, and again, new vaccines may be coming along there as well. So some associated factors, obviously aging, but this is a risk factor that I think gets ignored because people don't like to talk about being overweight because you're accused of fat shaming or some such word. Prostate cancer, I mentioned, quite common. The old finger up the bottom used to be the standard approach, which obviously put a lot of people off, and we can do other checks. And as I said, we're finding more and more cases of prostate cancer, but the question then is, are they of significance? Are they just an incidental finding rather than an important finding? For women, one of the big problems ovarian cancer is because it doesn't produce symptoms until fairly far on. And if there's no clue and there's no family history, then often that has a bad outcome. Otherwise, the uterus and cervical cancer is, it's one of the success stories of Australia with the development of a vaccine for human papillomavirus, which was the underlying cause of a lot of these cervical cancers. And again, vaccines are coming in as well. So big changes, really. So what about eating the right food? Well, I mentioned obesity is an important factor for a whole range of different cancers, a variety of them. And apart from obviously not being good for your health in general terms, I think the priority of weight reduction for health is very much there. And unfortunately, people, I think, are increasingly expecting to take a pill or an injection so that they can continue with their lifestyle and the weight will fall off. And that doesn't really solve the problem. So this is a study of, as you can see, from vegetarians and vegans, and they did suggest that there was a reduction in cancer rate related to certain types of diet. One of the problems with this, of course, is if you follow this sort of diet, your enjoyment of life is significantly restricted. So the old phrase, doctor, if I do all these things, will I live any longer? And the answer is no, but it'll certainly seem like it. So you've got to put the pluses and minuses together. And this is just talking about obesity, all the different types of cancers that have been associated with being overweight. So it's not just as you might imagine, diabetes, there are a whole range of different issues that go with it. So what can we do? Well, basically, we have to stop enjoying life, don't we? That's fundamental. So alcohol in moderation, and then you have the question of what is moderation in alcohol consumption? And then the answer is it's less than your doctor drinks. So if you pick the correct doctor, you're all right. Smoking, obviously, is sadly, the whole smoking saga has been badly mishandled by governments and taxation, and we've now got a recurrence of undercover smoking with gangs and crime involved. The smoking rate is going up again, as well as the vaping side of things, leading younger people on to smoking as well. Healthy diet, what are the preventatives? Well, maybe vitamin B3 reduces the incidence of skin cancers. Doesn't seem to have done much for me. Prostate, breast, these are proven orthodox preventative treatments once you've had the diagnosis made. So I won't go into too much with this, but there's some alternatives coming into the story here, apart from healthy diet, smoking, weight reduction. Flavonoids from some plants have been shown to or suspected of improving cancer outcome, but it's not actually been proven in humans. Ian may disagree with this, but this is my understanding anyhow. So tea, and green tea particularly, may have some benefits. Certainly it shouldn't do any harm. Again, vitamins seem to be thrown around for all sorts of activities nowadays, particularly the antioxidant vitamins, but there's not really evidence of benefit. And high-dose vitamin C may actually increase the risk of cancer. All these other additives as well, which Ian knows more about than me, to my knowledge, there's no actual clinical trial proven benefit with these either. What are the specific foods? I've just looked through these because they're more commonly suggested as helpful in cancer. Turmeric, animal experiments show that it slows the spread. My understanding is there's no clinical proof in humans. The cabbage family have been used forever for treating cancers, and they do seem to have some effect in animals, but again, unproven in humans. Similarly with onions and the onion family and the others I've listed here. So there may possibly be some evidence of benefit for some of the herbs as well. So ginger, soy, and licorice and so on. But it's all fairly tenuous. This is other options that are being looked at, chemicals coming from plants rather than actually plants themselves, and a range of substances, anthraquinones, looking at rhubarb being typical, various berries, and I won't sort of go through them all in detail, but There may be some positive responses, certainly in Europe, from what's called the Mediterranean diet. Not only has it been helpful in terms of longevity and heart disease, but perhaps also in terms of cancer incidence. So olive oil and soy certainly will do you no harm. This is probably getting outside my territory here. This is one of the modern additional approaches to not only cancer therapy, but general health indeed, looking for heavy metal accumulations that might have perhaps these sort of adverse effects on the body. Again, my understanding is that this is overrated and unproven. Again, Ian might disagree with that.
Very much so.
I thought you might. What these things do is they measure the level in the skin, which is not the same as the level in the blood. And I look at this on an evidence-based approach that you have to prove things work before you advise them. So there's some, spelling mistake, some possible links here that we've talked about. And should we actually be looking at supplementation? And unfortunately, cancer patients quite understandably look for additional approaches apart from the orthodox, and this may not necessarily do them any good. More again about heavy metals. Willie Nelson. Oh.
Got to sound here just a bit.
He's still alive, obviously. Yeah. So here is something simple that in cancer prevention that has been proven. Clinical trials using a small dose of aspirin. And aspirin, obviously, as you're aware, was originally a naturally occurring substance being extracted from the willow tree, the bark of the willow tree. And apart from its benefit in terms of heart disease and circulation problems, there is a big trial going on, which hopefully will clear the air. It appears that there's a reduced risk of cancer in taking a small dose of aspirin a day, apart from the heart and circulation, crikey. But this big clinical trial is going on and should be coming out next year. So this is not too easy. This is from the book I wrote on the subject 20 odd years ago. What it suggests here is the cancer site, the likely risk of reduction, possible risks of reduction. And in practical terms, plenty of fruit and vegetables, that about sums it up, I think. So let's talk a bit about cancer in general now. It's the second most common cause of death in the developed world. And in the developing world, it's also common, but totally different disease process because of different diets, different lifestyle, and so on. So what are the alternatives that you can consider when you've got this diagnosis? Well, options I've listed here: meditation, all sorts of strange things are put up your bottom nowadays, if you like that sort of thing. There are the options with vitamins, supplements, and minerals, and a whole swag of different herbals have been suggested. And I just use that as one example. 1,000 articles written on breast cancer with no proven benefit. So this is one of the problems that happens when you have somebody who is believing in this approach, that a lot of patients, a small proportion of patients, will abandon their proven orthodox treatment for an unproven alternative treatment. And then if you take both together, then that's equally a problem, because sometimes there is an interaction between the two. So what about vitamins? That's one of the options that's regularly thrown around. Smokers on vitamin A have more lung cancer. Vitamin C has some effects in some areas, but high doses is not of proven benefit. Vitamin E increases the risk of prostate cancer. Calcium supplements may increase cancer mortality. So there you go. It's not as straightforward as it's made out to be. Orthodox treatment now, back in my turf. Surgery has been improved by the addition of laser therapy. It's far more targeted than it used to be, far less disfiguring, but it's still after the horse has bolted approach in general terms. Chemotherapy, we'll talk a little bit about that. Radiotherapy is still used regularly. We have some additional options in terms of using radiation producing seeds that can be implanted in various parts of the body, like the prostate gland. So they're the orthodox treatments. And then going to the alternatives, what about what's available from plants themselves? Because plants get cancer and plants produce chemicals that actually seem to have some effect on cancer. And here's an example, an organism with a fairly unfriendly sounding name, but it does seem to attack different plant viruses. So can we actually adjust from these sort of conditions to humanity? And the world has been looking for the wonder cure forever. And if you look at research that has been done, for example, in the Amazonian rainforests, there are so many plants, and they've been spent 20 odd years going through plants looking for any evidence that they might have potential. And you can see 35,000 plants examined, 3 new drugs came out of it. So it's work in progress, still going on. And here are some of the more commonly used treatments for cancer worldwide. Mistletoe, particularly in Europe, for pancreas cancer particularly. Clover, silver birch. Colchicine from the autumn crocus, very good for my throbbing big toe when it starts up with an attack of gout. And a range of other things from different parts of the world you can see I've listed there. So this is mistletoe, you probably recognize that. Still commonly used in Europe, particularly in Germany, and it has been shown to activate the immune system and as a supplement. So it's still used in combination with orthodox therapy for treating a range of different cancers. The Madagascar periwinkle. I think I may have mentioned this last talk, but to me it's fascinating, and it shows how traditional treatments are not necessarily reliable. So this plant, used in Ayurvedic medicine to treat diabetes, used for a couple of 100 years, and I think I mentioned you can diagnose diabetes by somebody losing weight, passing lots of urine, dip your finger in it, it tastes of sugar. Diagnosis was possible in years gone by. When they actually tested this plant, they found it had no effect on sugar whatsoever, but they did find that it lowered the white blood count. And so from that, they developed these orthodox chemicals now, which are used to treatments of leukemia. Another plant-derived chemotherapy, hopefully none of you's had to be exposed to Taxol, but this is a plant which has been shown to have specific effects on cell division, and particularly fast dividing cells like cancer. And so this is the yew tree, Pacific yew tree, the origin of that chemical.
Sorry, can I just ask why the paclitaxel?
Why the?
What, when you said I hope no one's had the Taxol, why?
Yep.
Why?
Why?
Yeah.
Why did they use it?
No. Yeah. Well, why did you said I hope no one's had that? Why is it so bad?
No. Sorry, just on. I wasn't implying it was particularly. It's better not to have cancer at all, obviously, but that would indicate. Anyway, apart from making cricket bats from yew trees and things like that. Oops, gone the wrong way now. Another used, mytansine is another chemical used sometimes for treating cancers. Stomach cancer, I mentioned, is much less common now that we've realized there's an infection behind it. And there are different varieties thereof. Traditionally, it was used for treating stomach pains I think it was in Ethiopia, somewhere like that. But then we found subsequently it would have some benefit in treating stomach cancer. So there was a connection there. Here's another, and I've got no idea how you go from that to that, but traditionally used by Xhosa tribes in South Africa for treating cancer. And on research, they found these chemicals called combristatins, which can be used to enhance the effect of other chemotherapy agents. And this is always the funny thing, isn't it? The mandrake. Now, again, that's being sexist. It should be called the person drake nowadays, shouldn't it? But it's a source of etoposide, which is another chemical which is used for treating certain cancers. And this, because of its mysterious shape, this has always been considered a medicinal plant going back centuries. And you can see why people might think that's a bit spooky. As I won't go on too much, but I'm just pointing out here that there is no differentiation between alternative and orthodox treatment. When a plant or a chemical is tested and found effective, then it's manufactured and it becomes an orthodox therapy. So you've got different examples going down the list here, and I make the point that these have to be clinically proven. I don't know if any of you remember the Laetrile story. That was a wonder treatment of cancer back in the 70s. I was in New Zealand at that time, and I remember it being very much promoted. And basically, the apricot kernel, which is what Laetrile comes from, contains cyanide. So what you're basically doing was poisoning your body with cyanide. You might have killed the cancer cells, but also your own healthy cells. Anyway, that all fell into disarray. One of the things which just by common association gets mentioned is shark cartilage to treat cancers. And that's based purely on the story that sharks don't get cancer. Magic mushrooms, of course, make everybody feel better anyhow. I think we've done a bit through that. So Laetrile has now been well and truly banned in many parts of the world. But and in Australia, we had to go as far as banning the sale of raw apricot kernels because people were making their own with adverse results. This is more up to date from my part of the world. I did time in Sharjah in the United Arab Emirates. And this is a local treatment that was suggested as a cancer therapy. And looking at it, there is some evidence that it may have the ability to treat bowel cancers. And it's, again, a different population because of the different diet in that part of the world and the fact that their life expectancy was so much shorter as well, living in the desert. Not anymore. Dubai, obviously, is the den of iniquity nowadays if you want to be exposed to cancer-causing substances. So this is maybe another treatment coming from nature that could be a benefit. You guys probably know more about this than I, but a sugar substitute, stevia, which is commonly used as a substitute, may possibly have some effect on pancreatic cancer. So what they did was they fermented stevia with a bacteria which came from banana leaves. Who knows how these things are put together? I've got no idea. And they've found that this particular plant may have some effect on pancreatic cancer. This is early laboratory days, but pancreatic cancer is such a terrible diagnosis. It's pretty much untreatable. Anything that makes a difference is worth having. Now, this is one of the big wellness buzzwords at the moment. The gut microbiome is the cure for every disease known to man and woman. And obviously, it's work in progress, but there's a lot of chat which is not supported by clinical proof. And a whole range of things, including cancer and all sorts of diseases, are thought to be improved by attending to your gut microbiome and having transplants and all sorts of weird stuff. Support therapies that are commonly, I think, added in, and sometimes with concern. Echinacea, you've probably heard of. It's the purple coneflower, and this has an effect on the body's immune system. And then the question is, if it has an effect on the body's immune system, what effect is it having on the cancer cell as well as the immune system? So all these things have been, I think, certainly cleared as being of low risk, and different parts of the world you will have different examples to be found as well. Obviously, these are pretty uncontested, So symptom control is a different thing from actually treating the cancer themselves. We've been through a little bit of this, but just to point out that plants, all plants are not necessarily good for you. And obviously tobacco is certainly not good for you, but there are a few other I've listed here that are plants which have been used in medicinal therapies in different parts of the world and have been associated with causing cancer as opposed to reducing the risk of cancer. And in our part of the world, probably, well, certainly in the islands, chewing betel nut is, it has a mild stimulatory, it's actually a misnomer because you're not eating the betel nut, you're actually eating the leaf, the nut of a different tree, which is wrapped in a betel leaf, but that's by the by. But it's because they use lime to break down the nut into the stimulant, it can cause mouth cancer. They did at one stage try to introduce betel into the Northern Territory as an alternative to try and get Aborigines off the other stimulants that they obviously use. So is betel nut. As I said, it's now banned in Australia. And this is the Areca palm, which is what you get. Some herbal treatments relating to cancer therapy, again from my book. So I've mentioned these chemicals which actually have come from plants originally. And this is a list, I think we've mentioned most of these things that seem to have some clinical or laboratory evidence. And then there's a whole range of other stuff which is recommended without any proof. And the concern again is that there may be an interaction between the plant and the chemicals you're taking. So why aren't there more clinical trials of natural therapies? The obvious reason is cost. You can see that in clinical trials here, to get to the stage 3, which is what you have to do to be approved, estimated cost $20 million US per drug, and obviously as 9 out of 10 of them don't actually get to that stage, there's a lot of money goes down the drain. So if you're doing cancer drugs, cancer therapies with a naturally occurring substance, which if you prove it works, may not be patentable because it's a naturally occurring substance, then you get this difficulty. So bottom line is advertising is cheaper than clinical trials, and you get these clinical, these distorting words like may help with prostate health. Now, what does that actually mean? It's suggesting that it's good for prostate cancer, but I haven't proved it. Newer little things going on. These are some new bacterial research approaches. These particular bacteria, Japanese, they look Japanese, don't they? Japanese bacteria that are doing interesting research with in terms of immunotherapy. And this is a theoretical approach at the moment, but it may actually lead on to something like the gut microbiome being of benefit. This is another area of modern research. Who would have thought it? The old earthworm. And the earthworm really is a sort of canary in the coal mine, if you like, of environmental health. And you've seen examples, for example, somewhere like Chernobyl, where after the disaster there, the flora and fauna has returned to normal again after 40 odd years. And a lot of research has been done on the earthworms because they reproduce in large numbers and they reproduce rapidly. So they're great for doing research upon. And the other thing, earthworms don't get cancer. So is there some specific compound that they have that can be worked on for human therapy? And it's being looked at, this chemical lumbricine from the earthworm, and research is being done at the moment in a whole range of things. Getting old, obviously, we can't do anything about. We can do anything about our weight and our bad habits, but getting old is one of life's inevitables. And there's a lot of work being done at the moment about these things called telomeres. Now, these are on the ends of the cell, on the ends of the DNA, and as we get older, they get shorter. And this seems to be associated with degenerative diseases, including cancer. So is there something that can be done to stop our telomeres shortening? And sometimes we've looked at nice things like alcohol again, grape juice, and we're looking at, they've now got some chemicals developed from a Chinese medicine, which seem to be able to reverse the aging process. Then, of course, you have the question, we've got too many old people around anyhow. Do we want them hanging around for still longer? That's, who's going to pay for them? Who's going to pay for them? So, and then on the opposite side of that, there is research which suggests that if you're actually stopping the telomerase, this may also have an encouraging effect on the cancer itself. So who knows? It's all up in the air, but things are being developed. Who would like to put a name to that? But natural sources of substances which seem to affect telomere reduction, I've listed a few there that seem to have some benefit. Certainly they will do you no harm. They might make you a bit more windy and antisocial, I suppose, but that's another thing. Glutathione, this is a recent development. So glutathione, which is a small group of amino acids may have some effect on cancer because cancer cells use it as a fuel to encourage their growth. So can we introduce diets which reduce the glutathione intake, or can we actually find other substances which will work on that aspect of cancer as well? Early days, but there's lots of things going on from natural sources. Now, you all have different views on what works and what doesn't. I stick with the concept that something has to be proven effective before I would recommend it. And this is a lot of options that are currently being promoted with no evidence of benefit. What's the future going in? Well, I think better screening tests for cancer are certainly occurring. Better individualization of treatments, so your cancer cells will be removed, they'll be brewed up. Your anti-cancer cells, which also be brewed up specifically to deal with that cancer, and then injected back in. It's expensive, but it's a one-off option. So that's the future, I think, and it will become more and more common. And similarly, vaccines for your individual cancers too. So all sorts of things going on still. So problems of aging. Well, I can't do nothing about that. I don't get over enthused about renewable energy. So this is just, I look forward to getting older, but having to convert to solar is just so embarrassing. So there's your earthworm with a solar panel attached to keep it going. That's it, guys. Thank you.
Very much.
Can I just ask, you've obviously written books or have written books?
Yeah.
Is it possible that we could have some copies for the library?
I don't think so. I think they're out of print. Did I give you one, Chris? I can't remember. I've got 2 or 3 copies left. I can maybe give you one. But it's
You'll have it on film.
it's 20 years old, and so it's probably things have moved on considerably in that time. Yeah,
Still valuable. We've got a lot of things around here that are 20 years old. Yeah.
including the the residents. Yes, yeah.
Survival medicine.
Yeah.
I think that's, that's a thing.
But as I briefly alluded to, I've seen traditional medicines in different parts of the world. So I understand if there is no alternative, then that's what you do. When you have an alternative, I think it's important to make sure that the traditional treatments have proven benefit. And I made the point there that because it's been used for a couple of 100 years to treat something doesn't necessarily mean it works. So a little bit of caution is required.
Yeah, it's good to have that information. Now, have we got any questions for Graham?
I'm sure Ian's got thousands.
Oh, yeah. I'm sure he'll
Shush,
shush. He'll
shush.
follow you over a cup of tea or coffee.
Yeah.
But there's no further questions. Again, I'd like to extend our appreciation to Graham. This is the second in his series of 3. So we're very pleased to have his skill, knowledge and expertise. It's always very interesting to get a balanced view of things, especially when we're in the holistic, non-invasive space, and to also get his wisdom as well. So I find it very enlightening. So thank you very much. Please join us for a cup of.
And just
Is
to
it
say,
dangerous to have tea or coffee?
just to say, number 3 is coming up. When is it?
2 months.
Yeah,
It'll be-
2 months' time. So this is going to be not cancer related specifically, but my view, reasonably up to date of, in all aspects of medical health, what natural therapies have been proven effective. That's the concept there.
This will be the crowning jewel in the 3 presentations. So this will be one that will really bring to the fore Graham's opinions and his knowledge, which we'll certainly value. So please join us for some fellowship, and then in about 15 minutes time, we'll, for those who wish to come back for our support group meeting, that will be hosted by Eve and Catherine, and that'll be here very shortly. Just by way of advertisement, we've also got our sound healing bed, which Caroline loves. Yeah, she wants to take it home, and Mark enjoys it as well. So please try it out. It's an amazing thing. And Royal Rife Machine, we're getting some really good feedback on Rife, so we're doing more and more treatments, and we're booking those in as well. So happy to promote those.
Have we got
as
any
well.
double blind placebo-controlled trials on that?
Yeah,
No.
60 years worth. All right. So thanks once again. Thanks to our online audience and our video touch audience. Thank you very much. Very good.
Guys.
Thank you.